Hello, my name is Ryan Hall, and with my co-author Susan Hatters-Friedman, we have written an article entitled Guns, Schools, and Mental Illness, Potential Concerns for Physicians and Mental Health Professionals, which will be coming out shortly in Mayo Clinical Proceedings. We ask that when people read this article, they keep in mind the notion of unintended consequences. As a field in general, we want to save life, encourage healthy behaviors, and things we can do to improve these aspects in general our field is in favor of. However, the topic of mental illness, especially with firearms, is a very complicated area, and although in our enthusiasm to try to improve society and save lives, we may accidentally take on roles or responsibilities that could ultimately lead to harm for our patients as well as for our profession. In this paper, we try and look at concepts such as how do we balance civil liberties with the need to protect society, and exactly what physicians should do to ensure that these balances are met. We look at laws such as the New York SAFE Act, as well as potential laws in Florida such as the gag law, as well as some proposed laws on submitting patients to national databases to prevent them from being able to purchase firearms. A lot of these regulations and laws came out of national tragedies such as Sandy Hook and Aurora, Colorado, which seemed to involve individuals that were school age. For that reason, we also look at the notion of screening in high schools. Whether or not this will lead for people to be targeted will result in impact on individual civil liberties. We'll also look at the notion of what physicians really can do to improve safety. Do we need to have changes in civil commitment laws? And if making those changes would also lead to others being concerned about loss of civil liberties. In addition, we review some of the laws that are already existing, such as the Ombudsman Crime Act of 1968, and discuss that the Supreme Court has already ruled that certain individuals with mental illnesses can have laws or can have their gun rights curtailed. In addition is the question that if physicians did report people to national databases, would that meet due process challenges, because it would effectively remove the judicial oversight and review which has traditionally been involved with the removal of rights from those with mental illness. When we discuss screening, we also look at the issue of what about people who do not want to receive additional mental health care. When you look at Jared Loeffner out of Arizona, he had been identified early on as an individual with mental health. His school had actually encouraged him to get evaluation and treatment before returning, but he just simply refused to go back. As many of us in the field of medicine know, compliance is often a difficult problem, whether we're talking about with psychotropic medications or medications like blood pressure and diabetes. So how do we improve this? Again, do we need to make changes in our civil and outpatient commitment laws? Do we need to force more outpatient medication and involuntary medication orders? In addition to talking about large laws and changes that can be made there, we also try and look at things that individual physicians can do. We review some of the literature that talks about whether or not physicians discuss with their patients firearms, why that there may be a dearth of studies regarding firearm safety and physician education. And we also encourage physicians to maybe take a gun safety class themselves. We may not always be able to control what our state legislature or federal government does, but we can try to encourage and know what our own knowledge base is and take steps that make us a better practitioner on our own levels. For these reasons, when you read this paper, please do keep an open mind. We do know that this is a very complicated topic, and again, we're not discussing whether or not people should not be shot. We're all in agreement that nobody wants a child hurt. The question is how best to go about making society safe without becoming an agent of the state.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.